Monica can have
You
it.
got Penny Wegman, Myrna Molina, Chris Caius, Keno Snowden, Blair Peters, and somebody I don't recognize.
Bunch of half steppers.
Want to give another minute? See
Right.
if it's on, or?
Somebody's on it.
Whoever come to the meetings, if you want to be here, you gotta come to the.
Auntie Thomas is on the phone.
Angie.
Like, I'm
It's
here.
not Monica.
So mine.
Thank you, Angie. You can rename them if you want to.
Not charting properly, she will join as soon as possible. She doesn't have the link.
Okay, all right, we'll get it started then. All right.
Well, you have to check to see if you have.
Oh. We got 3. Angie's on, that's 4. So. Is Deb on?
There's 4.
Well, Kenyon, me, Steve, and then Angie's on. Angie's online though. So, okay, we're good to go. Okay, I'd like to call this meeting to order of the Public Health Committee for Wednesday, August 19th, 2020. I'm Jarrett Sanchez, Commissioner Jarrett Sanchez, filling in for Commissioner Anita Lewis, who's not able to make it with us right now. Okay, I'd like to ask the clerk to call the roll for attendance.
Allen, Kenyon,
Here.
Sanchez,
Here.
Silva, Thomas,
Here.
Weber,
Here.
Lewis.
All right, we have a quorum. Can I get a motion and a second for the approval of the minutes for June 17th and July 22nd, 2020? So moved by Mr. Weber, seconded by Mr. Kenyon. Yeah, clerk, call the roll, please.
Kenyon,
Mr. Chairman,
yes.
I had a correction. To the June minutes, which I submitted.
I did
Karen?
send an amended copy. Did you get a chance to look it over yet?
No, I did not, but I'll, if you got the correction, then I'll trust it's accurate.
Okay, would you like us to defer them till next month or so you can review it?
I would prefer, yeah.
Is it just for the 1 month? For June. Okay, so Mr. Weber and Mr. Kenyon, would you amend your motion and second to just apply to the July 22nd?
Yes, I'll amend.
Okay, clerk, call the roll, please.
Okay. Thomas,
Yeah.
Weber,
Yes.
Sanchez.
Yes. All right, under finance and budget, we have financial reports, and I don't know that we have anyone that's actually giving us a report on that. If there are any questions, you guys know who to talk to. Public comments on agenda items. I don't know if we have anybody online for public comments. We certainly don't have anyone in the crowd today. Mike, do you have any comments, anything? Do, but
My
not for-
questions were satisfied by the director.
Excellent. All right, on to the director's report.
Good morning. First, as always, I'd like to bring your attention to our flash report. The health department went and listed mobile testing that we got through the Illinois Department of Public Health, and they allow for local health departments to bring mobile facilities around to give testing in high targeted areas. And so, as you can tell from the dates listed before, we went into areas that we hadn't gone before. Geneva, Elgin, Carpentersville, St. Charles, Aurora, and we did over almost 3,000 testing. And we did some more the next week. So for the month previous, we had done approximately 8,000 tests. And with the tests that we did, increased our numbers by 11,000. So it's important that we have as much testing as possible because what we're finding is people are being asymptomatic and they're continuing to be out in the public. And so if you test, then you will determine if you're positive or not, and then quarantine yourself or isolate. The next item I want to bring, I know we're have a lot going on with COVID, but we have to have other things that we have to be conscious of. And I want to bring your attention, you've heard this in the news. It's called multi-system inflammatory syndrome in children. And they're finding that this is associated with COVID-19. They don't know all the information yet because this is new, this is novel as well. And it's a syndrome in children, and it's a condition which is where different body parts can become inflamed, including the heart, the lungs, the kidneys, the brain, the skin, the eyes. And according to the CDC, it's rare but serious condition that can be deadly to children. And most of the children that have come down with this syndrome have had tested positive for COVID-19 or was in close contact to those with COVID-19. And so I bring this about so as we look at, as I showed you before, the numbers of children cases are increasing so that parents can be aware and begin to look for the symptoms of this rare syndrome and to be conscious of it. Is not just as we get in the flu season. So it's trouble breathing, pain or pressure in the chest, some confusion, inability to walk, and several others. But it's important that parents remain vigilant and really watch out for their kids during this difficult time because this is a significant syndrome. And last but not least, August is National Immunization Awareness Month. And I recognize, again, we're all consumed with COVID, but the school year, it's important that all of our children have their immunizations because on top of COVID, if we don't immunize our children, we can have a potential of outbreaks of measles, mumps, or pertussis. So it's important that we don't have one infectious disease on top of another. So please contact your healthcare provider or the health department so that you can get your children's immunized and protected. And that's what I have for my flash report. And then I will go into my COVID update. Roger, can you put that on, please? Mark. So each month I'll bring you an update where we are. And one of the things that's important, next slide, please. The health department's response to COVID is to do mitigation, containment, control, and mass vaccination. Next slide, please. We use the data to reduce COVID-19 in Kane County. Next slides, please. And as I brought this to you before, and I will bring it to you every month so you can begin to see the trend analysis. What this chart represents are the age groups and the age distribution of cases that we're seeing. And so I want to highlight again the brown, can I have a, yeah.
Very good, Roger. You know what you wanted.
He's a mind reader. Okay. All right. So I want to bring your attention to two areas of growth. So this bar shows an increase. So when you look here, there wasn't the increase. We had our seniors more prevalent in the earlier stages of the virus. Now we're seeing our 20 to 29-year-olds coming up and having lots of increased cases. And then we see the other group that's increasing is this orange case, and these are children between 10 and 19. And what we see from the data is that the 20 and 29-year-olds are in a lot of congregate settings, parties, bars, those kinds of things, not masked and not social distancing. And we attribute this to when the sporting events began to open up, children began to engage into those activities, and so therefore was a spike in that age group. This is a new slide I brought today. So one of the problems, as you know, we're engaged in contact tracing, and one of the problems is with contact tracing and the spread of this virus, if we don't have good lab test turnaround. So if you get your test today and you don't have a result before 7 or 14 days, it's a moot point because now you've gone everywhere and you're shedding the virus, especially if you're asymptomatic. So what I brought here today, if you can see, this chart starts from March, and the spikes you see, the average lab turnaround. And so in the beginning, you see where it was 2 days, then it crept up to 4 days, and then around June, you can see it went all the way up to 6 days. Now, 6 days after you've been, how many people can you expose? Remember, I showed you how it populated last month. So it's really important that we have labs and the capacity at these labs to turn test results around, because we can't do contact tracing until we have a test result. Next slide. And this chart shows the turnaround time just this past week. And so what I want to share with you, depending on where you go, all labs don't have the same turnaround time. So if you look at this chart, you'll see on average, this is 5 days. But these dots, see these dots up here? That's 25 days. 15 days. Once we get out there, it's very difficult to stop the spread because you've been out that long, and I've had the community call me and say, you know, my employee's been out 14 days. They don't have a test results. Can they return? And we have to say yes, because that's the mitigation time. But it's really important that we get a handle on these test sites, these labs for turnaround, because that's going to be critical in stopping the spread. The next slide is to show you, if you don't go on our webpage, as of yesterday, Kane County had 10,458 positive cases and 306 deaths, which again highlights why it's important that we have support in contact tracing. With 60 plus people, we can't manage 10,000 cases. Okay, now I want to bring to your attention, you saw the press release I put out last week, and last month I reported that we were in Region B with DuPage County. However, the state also monitors each county individually. IDPH has 6 key indicators that identify early significant increases of COVID-19 transmission for each county. The purpose of the indicators or the metrics are to bring awareness to counties and to identify spikes in the disease burden early so that we can make some informed decisions about how we promote healthy behaviors in our community and reduce the spread of the virus, and find out why. When the county is hitting all the target metrics, the chart shows blue. However, when you begin to surge in 2 or more of the metrics, the chart turns orange, which signals you are in the warning status. Unfortunately, on August 14th, Kane County had 2 metrics that turned orange, which puts us in a warning status. The 2 metrics were the number of new cases per 100,000 and 20% increase in deaths. The target is to stay below 50 new positive cases per 100,000. Unfortunately, we reached 105 cases per 100,000. The data helps us identify where the new cases are coming from, and we can determine by the data that the 20 to 29-year-olds continue to increase in positive cases, and contact tracing tells us people are continuing to congregate in large groups. According to IDPH, target for the death metrics, which requires a county to have less than 20% increase in deaths in 2 consecutive weeks. So on week 30, and it's highlighted here, week 30, you see at the bottom here, we had 4 deaths. In week 31, we had 5, and then the next week we had 7. So small numbers could really increase your death rate, okay? And so as a result of that, we exceeded 20% 2 weeks in a row on our deaths. So therefore, we were put in orange, which is a warning stage. What does that mean for us? We must all contribute to keeping the numbers down by using the only tool we currently have, and that's by social distancing, limiting the number of persons you're around, wearing a mask, and purchasing good hand washing. Practicing good hand washing. The other thing is, these are county level. You don't go into the enforcement stage of the tiers until you go into region. People have been confused about that. So the region level means that's us and DuPage both have to be in a stage of warning to go into the enforcement phase. Does that make sense? So right now it says, okay, Kane County, what are you going to do? Figure out why this happened, where did this occur, and how can you mitigate to push it back into the blue? And so that's our goal. So in containment, what are we doing in containment? So these are the things we do in containment. In education, we recognize we must, thanks to some of the funding we have, we are going to be able to do a better marketing strategy, provide education to folks. We all must wear masks. So one of the things we have to do, and as we learn and purchase more PPEs, we learn, like most of the people in the JJC in the jail, they must be masked up. We encourage everybody and ask that you help us, help your community constituents wear masks. We have to also practice good hand washing, social distancing, and contact tracing is imperative, and I'll give you an update on that. And more importantly, stay home if you're sick. I can't say that enough. If you're sick, stay home, because that's how the virus spreads. So contact tracing key milestones. So as you know, thanks to the CARES Act, we were able to get some assistance from a vendor to do contact tracing for us. And one of our goals was to do it in 24 hours, and with 10,000 cases, that's virtually impossible. So here's the status. On July 30th, Salesforce contact tracing platform was launched by the Illinois Department of Public Health in Kane County. And the next day, the contact tracing kickoff with our vendor, KPMG. And then so think about that, on August 31st, and by August 4th, KPMG had hired 91 contact tracers, 38% of the total 160 we are required to have by IDPH. 23 of those were Kane County residents, which is 28%, and 13 were bilingual, which represents 14%. And as a result of that, this past Monday, we had our first live calls. And so last night I was looking at the data, and they have made over 491 calls. So that's pretty exciting, because we could not do that in our capacity. And I will continue to bring the status of that. So transmission. What are we finding from our data about transmission and where it's occurring? We're finding out, of course, in households. Once people find out they test positive, they don't always isolate themselves within their own homes. You really need to isolate yourself from your family, and you can prevent your family members from becoming ill and positive. Stay out of large gatherings. We're getting a lot of anonymous calls from our community that people are hosting weddings, over 100 people. They're having private parties at clubs. They're in congregate settings, like in our jail, our JJC, and our nursing homes still continue to be where we're having positive cases. And this is through transmission from person to person. That's what this is a result of. And our case count will continue to go up, and we'll continue to stay in the orange if we don't stop doing some of these large congregate settings. I had a gentleman call me and told me he was driving by and saw a wedding. He saw the cars, and he said, I know it had to be over 100 people at this function at a person's private house, and he was just livid. So we have to, I think people are thinking they could take it privately, and they don't have to mask, and they don't have to social distance. And then you have to look at it, then those people leave that party, and then they go back out into the community, and they bring it to their coworkers, their families, and their friends and neighbors. So how are we going to look at control? Well, we will work with our schools. We're working with our schools with their educational plans to keep kids safe. If you've heard in the news, there's been a lot about how There's 3 different models for children to return to school. They can come back full. They could come back in a hybrid where some come and some don't. And then some schools are opting to still do school at home. So we're working with our schools to help them keep kids safe in terms of their social distancing and those kinds of things. And the Illinois Department of Public Health is working very closely as well with the Illinois State Board of Education to help mitigate some of the school plans. We also are doing community-based testing, as I informed you earlier. And yesterday I saw a notice that if the community would like to organize a community-based testing, it no longer has to go through the health department. You could have your own constituents call. And if they want to organize that, then they can organize a community-based testing site. The state wants to really increase its test outcomes. And so I would encourage you to look on our website to get the link for that. We're in phase enforcement, and that is, you know, we're in phase 4 and we wish to stay there. We don't want to go back, but if we have to go back, it would be through the tier enforcement, as I talked about earlier. And the tier enforcement in targeted areas would go with this County of DuPage. I've talked about our school plans, business plans. It's really important that business community do symptom checks with all their employees. They should consider policies around travel. People are traveling to hot spots and coming back, bringing back the virus. And since it's not a executive order, I just implore that some employers should consider some really good safe and wellness policies within their business establishment to keep their employees safe. And then more importantly, we all got to take personal responsibility if we're going to control this. We all really need to check ourselves and make sure that we are following the guidelines. And last but not least, we have to have very good infection control plans in our settings, like in nursing homes, our jails, and things where people are in large numbers, and it's not possible not to be in large numbers. So I ask that you join us in reducing the spread of the virus in Kane County. Social distance, wear a mask, practice good hand washing. It's a mantra, but that's the only tool we have in our toolbox today until we have a vaccine. And we are currently working on plans on how we would deploy vaccine once it becomes available to King County. That's all I have.
Thank you very much for that update, Director Jeffers. Does anyone here or on the phone have any questions about her report? Nobody? I do have a question. I want to thank you guys for organizing the testing sites in Carpentersville. They're very successful. I heard the complaints that people had to wait 3 to 4 hours at some points, which, I mean, that's a good problem to have, though. It means people are showing up. You did mention the turnaround time for the labs is kind of high, and that's probably, besides, you know, the wait, everybody's got to wait, but not getting the results back in a timely manner was probably the #1 complaint that I received from people. What is the process the state is going through to kind of improve that? And I know there's also a number that was sometimes hard to get through, but not everybody knew to call the number if they weren't getting the results back. So to add to what I'm saying, maybe we could promote that more as well when we have these testing sites.
Thanks for that feedback, because sometimes the community doesn't always share that with us. So first, the state is looking at increasing their lab capacity outside private labs, because of course the state has 3 labs, and 3 labs just do not have the capacity 7 days a week to do all the testing that's occurring. And secondly, the private labs have capacity. So one of the things we have to encourage the private labs to do is to do a quick turnaround. I mean, they can do the testing, you can do thousands of testings, but if you're not going to take those specimens and get them resulted, then that doesn't really help just to having a test. So it's important that IDPHs, they employ these private labs to really have them increase their turnaround time. If you don't have lab capacities, in my opinion, we really shouldn't be doing as many tests if we can't get the turnaround time. And secondly, we have regular meetings with IDPH. I will share that they are not being informed that where they need to call, and we will try to put that on our website. One of the problems with that, we have so many multiple test sites, and I don't know which one you're attending, so, and it's not always the same number, I don't believe, but I'll double check that, but I'll explain it to IDPH. They really probably should leave with something in their hand so they can return a call if that happens. And if they don't, we'll see what we can do for our residents in terms of making sure people have the information so that they can follow up with their test results.
Yes, excellent. Thank you very much for that. And I was telling people too, just call that number, and it would happen that they called and their results were in. And it seemed it was mostly people that were negative. So I almost
that's
wonder,
good.
were they kind of contacting the positive cases? Because we just had so many people
Right.
that call, they prioritized the positive cases, but that still leaves a lot of negative cases in limbo, wondering if they're, contagious or not, and trying to stay home. So that's good that we can get some work done on that.
No, that's a good point. Did they prioritize the positive cases and didn't return? Because the negative cases need to know just as quick as the positive cases. So I will follow up with that as well. That's the first time I've heard that, so that kind of makes sense if that's what they're doing.
All right, anybody else have any comments or questions?
Mr. Chairman,
Commissioner Allen, go ahead.
thank you. It just seems like this is a problem for the whole country, that it doesn't understand why the testing is important. I listen to a lot of news here at home with my husband, and it's just breathtaking to me that people seem to have such a hard time with the connectivity between being tested, getting results, and then sharing your results if in fact you are positive, so you can try and protect the people around you. Isn't it just amazing to anyone that we have arguments about the value of testing, and the fact is that we don't seem to know on a national level how to use the testing to protect ourselves. I'm just venting. And Mr. Chairman, thank you for sitting closer to the mic. We appreciate it, those of us who are out here.
You're welcome. All right, anyone else? No? Okay, I know we have a resolution. Can I get a motion and a second to discuss and possibly pass this resolution? Moved by Mr. Weber, second by Mr. Kenyon. Director Jeffers, would you like to explain this?
This is
resolution to us?
replacing one of our environmental health inspectors. It's a replacement. These are the people that go out and inspect your restaurants, your food establishments, our wells. An employee left to relocate to another part of the country.
Commissioner Hanson, you have a question?
Hey, good morning. Thank you. It's not regarding a resolution. I can wait till later, but it was a question for Director Jeffers. A lot of the state testing sites have been transitioned over into private companies, and I was asking her how that transition has gone. Are these new companies maintaining the same level of testing capabilities, and what kind of feedback are you getting regarding the work they're doing?
So the data will show you and the complaints we receive. When the transition happened, it was a rocky start. There were some long delays in testing and lines that were not there when the National Guard was there. But now we're finding that in our community anyway, that the private companies are doing a much better job in efficiency and getting people through the line. But as Commissioner Allen stated, around the country, this is a problem. This is not unique to Kane County. We are struggling with having efficiencies in our testing and turnaround time. And as Commissioner Sanchez said, people in various areas are still having long wait lines. And so testing still continues to be a challenge all over the country. But to answer your question, they are getting better.
Okay, thank you. I heard it was kind of like you said, it was a rough start for when they did take over, but I'm glad to hear it's getting better.
Thank you, Commissioner Hanson. All right, if there are any questions or comments on this resolution, take them now. Not seeing anything online. Clerk, can you please call the roll?
Ellen,
Alan, aye.
Kenyon,
Yes.
Sanchez,
Yes.
Silva,
Silva, yes.
Thomas,
Yes.
Weber,
Yes.
Motion passes. Okay, moving on to animal control. Do we have Brett on the line? Yes, okay. Brett, if you're there, go ahead and unmute and deliver your report.
Yes, hello everyone. How are you? Can you hear me?
Yeah, we can hear you loud and clear.
Wonderful. Good morning, everybody. Animal Control is very excited for the first month. Our revenue exceeded our expenses again for the past 4 months. We weren't able to. It seems like veterinary hospitals are doing similar to what we're doing with the mobile style. Some vets are having you exchange your animal at the door, bring them in, you go sit in your car, they contact through phone. So it's very different, the world we live in now, but vets have really adapted well. And from what we're hearing from the veterinary community, people are heading back in, taking care of their animals, which again is exactly what we want to hear. So that's very positive. Fingers crossed it continues in this direction and we don't have another setback, but we're very positive that things will continue this way. We do have our next vaccine clinic, our drive-through vaccine clinic. We'll be going out in the papers here shortly. Will be this Saturday, the 22nd. Again, it will be our drive-through mobile style here at our facility in Geneva. We're very excited. We've made some changes. We learned a lot in our first clinic. The good news is from the first clinic, though, is not one person got sick. 2 weeks after, we all kind of celebrated that we were healthy. 3 weeks after, we were happy we didn't hear from any contact tracers that something happened. So we're going to keep our tight protocols on the staff and ensure that everybody follows them perfectly, make some minor changes to the flow of the clinic to help people move through a little bit quicker. Excuse me, because the last clinic took about 6 hours. So we have some wonderful changes we're hoping to make to it. And again, we hope this is a very successful event because it's about helping these people in the community that really need it, especially keeping these low-cost vaccines. The seniors, this is a huge thing for them to be able to get it at a cheaper price because sometimes it's a little bit more expensive to go to your veterinarian, and we want to be able to help ensure that everybody's within the confines of the law. And that's kind of all I have this week. This month, I should say.
Thank you for that report, Brett. Does anyone have any questions for animal control? Mr. Kenyon.
I don't have a question, I have a comment. This is Mike Kenyon. A
Yes,
friend
how
of
are you?
mine recently tried to adopt an animal, and I know you can't do anything about from Anderson, but they have a terrible protocol. They gave up at Anderson and they went to DeKalb. They couldn't come in and look at a bunch of animals and select one that they thought they could get along with. At Anderson, you have to apply, wait, you see one animal, go home, apply, wait, see another. I mean, they're not doing themselves any favor. Anyway, this family went to DeKalb and they were quite satisfied over there. I know you can't do anything about it, Brett, but maybe you could suggest different protocols to them.
They are private. It's a little difficult to tell other agencies how to run their facility. I do understand their frustration. That is not a protocol we do follow here. We do appointments to view animals, and if you come in, you're allowed to view every animal I have up for adoption. But I do understand that family's complaint, and I'm very happy that they were able to find an animal. Next time, look at King County Animal Control. But I do understand what you're saying, and if I have a conversation with them, I will gladly bring it up.
That attitude is why you are here now.
Oh, thank you.
Well, going back in history, we didn't have animal control, but they were so unreasonable. They just, so Kane County had to take this, the bull by the horns, as we say on the farm. And you have our own animal control because the Anderson people were unreasonable. So I know you can't change it, but it's a comment. I don't know, they have no ears, they can't listen, so
They might hear this. You're putting the pressure on.
I will continue to do what's right by the citizens of Kane County, and I really do appreciate your support.
Chairman Sanchez, this is Ms. Thomas. I have a question.
Go ahead, Ms. Thomas.
And this is something for for a future meeting and maybe even next year. But it's my understanding that if there's a dog on the loose, we don't call animal control. Is that correct? In the unincorporated area, you basically have to call the sheriff. Is that correct?
Well, it depends. During the day, if it's in unincorporated, you call Kane County Animal Control. If it's in the evening, the animal has to be confined, and you still call Kane County Animal Control. Now, if you need an immediate response on something, yes, that would be the sheriff's department. Reason being property damage. Say your animal's been bit. I'm going to put together a presentation that will review a lot of the laws for animal control to help the board. I'm hoping to do that once things settle down a little bit, because I would like to get everybody in to really hear everybody's questions, because I think it's very important that people don't fully understand what we do here and what the laws are. And this is a perfect example of not fully understanding, because yes, we do go out during the day to track down an animal. Now, if it's an animal we don't see and it ran through my property 6 days ago and I'm calling you now, it's very difficult. But if it's, I see the animal, here's the animal, we're going to come out and do our best to kind of get it. We have set traps in the past. We don't like setting traps just because you wind up catching every other piece of wildlife in the world. But again, we have everything within our means to track an animal. The only reason at night we don't is we're paying time and a half to a warden to go out, and that can be up to 40 some odd plus dollars. So that's very expensive to be chasing an animal all over a neighborhood in the middle of the night. So from 8 p.m. to 6:55 p.m. or 6:59 a.m., we don't chase animals. But during the day, if it's in unincorporated, we will go out for those situations.
Okay. Well, I look forward to that presentation. And if you could also include information about animal hoarding, like who do you
I'd
call
love to.
if it's yes, because I mean, there are instances like that, and it's like, okay, who do you call? Is it
No,
animal
not a
control?
problem. I'm the Kane County Hoarding Task Force. I am the representative for animals. I do the presentations throughout the county on this, so I would be more than happy to go through hoarding of animals with anybody.
Okay, thank you.
Of course.
Mr. Weber, you had a question or a comment?
No, I changed my mind.
I should have called on you first. I'm really curious what you had to say. Does anyone else have any questions or comments for Brett in animal control? Okay, we do have a resolution. If I could get a motion in a second to discuss and potentially pass. Mr. Kenyon moves. Mr. Weber seconds. You guys are on fire today.
You know, we have to carry the load for everybody.
Brett, could you explain the resolution to
Yes,
us?
this is going to be a rehiring of some of our essential personnel. We have weekend personnel, part-timers. They come in and clean the kennel. They do about 11 to 12 hours per week work. They help take some of the load. We used to have 3 full-timers. 1 full-time position got moved to some part-timers. It's college students that are part of the animal program, usually at Aurora. They graduate, they move on. It's very unfortunate. We love having them. So this is the position to refill that really important cleaning personnel for the weekend.
Okay. Does anyone have any questions or comments on this resolution here or online? No? Okay, clerk, call the roll, please.
Ellen,
Alan, and I want to say thanks for being resourceful in finding people who are interested in participating, even if they move on. At least they're there for a while, and we get the benefit of them being interested. Thank you.
Thank you.
Kenyon,
Yes.
Sanchez,
Yes.
Silva,
Silva, yes.
Thomas,
Yes.
Weber,
Yes.
Resolution passes. On to old business. Do we have anything specifically in old business? I don't know if you guys had anything planned. I actually do have a question. It relates to COVID, and it's kind of something we've already talked about, but the mental health aspect of all of this. I know there's a component of that in the CARES Act allocation program that you're running. Can you just briefly discuss where that's at and what it might look like?
So one of the things we recognize is that people are suffering from anxiety, stress, depression, and a variety. And so our goal is to put together a platform to reach out to those individuals to find if we can't be the resource because we don't have a clinical setting, but work with our community partners to provide access to these various services. And one of the things we all have to rely on is telemedicine. And one of our challenges is going to be not everyone has the technology to do the access for telemedicine. And so we have to figure out, other than sending you materials, because that's always not efficient either. So we're trying to figure out how can we reach the population. And what happens is, this is why contact tracing is so important, we will find that out through the contact tracing as well. What are you experiencing? We already know a population that is experiencing some troubles, like the seniors and those who are afraid to come out. But it's those others who we have no idea, and you find that out. That's part of the interview in contact tracing. You get additional information. And so that's why it's important we have a resource coordinator. So we figure out what are some of the things you need, not just mental health. You might have some issues with having some anxiety of getting your medication or food delivered. There's so many things that impact this. And so that's where we're looking to go forward to in terms of addressing that.
Thank you very much. I know it is a really important thing. We have the virus, but once that blows past, we're going to have a lot of
Well,
blowback on the mental health side.
Well, it's not just our community, but it's our employees too here. The health department, essential workers, I think the sheriff's, all the people who are working around the clock, we got to look at what their mental health, and they may not know it till it's too late. So it's really important that we're proactive. We did a Zoom meeting with the health department staff. One of our employees, she does the children's mental health, and so she did a presentation for my staff to have them be conscious of some of their concerns and issues they're having as we go through this, because they're so immersed in it. So people who are immersed in this, your healthcare community, the doctors, the nurses, our FQHCs, people think, well, they're the ones on the front lines, but they also struggle with some of the stress that's related to this as well. So it's not just the average community members, it's those who also who are on the front line, who's dealing with the everyday, the firefighters, the police officers. And there's a group of people who are really struggling as well, and sometimes they don't acknowledge it.
And I'm pretty lax in reminding the public, but we have 211 services in Kane County, and they're very important for people to be able to reach out.
Exactly, and that service is also being shared during the contact tracing.
So, all right, thank you very much for that. Appreciate it. Mr. Kenyon.
I had a question I just thought of for the director. What has the effect been on the homeless population?
So we have 4 levels of homelessness, 3 actually. We have the largest the largest homeless shelter in Aurora, Hesed. Then we have Lazarus House in St. Charles, and then we have the pads in Elgin. So initially, it was a huge undertaking to get those people from being, we had, I think, an initial like 3 or 4 who were positive, and then they had 200 people. So thanks to some support from the sheriff as well, we all worked together with the city of Aurora, the sheriff, and the health department around the clock. That was like a 2-week endeavor to put them in a hotel in another county for approximately 30 days, and that FEMA supported. And then they came back, and so the health department's been working with them weekly on the plans of mitigation, so keeping them separate. So the downside with people who are transient like that, when it got warm, people began to leave the shelter. So we work, that's what's called an infection control plan. And so part of the plan we gave them, if they leave voluntarily, they cannot come back, because if you go out and become positive, and then now we got hundreds of people who are affected. So what we're working on now is what's going to happen when it gets cold, because they're going to come back in, right? And so we're working with them. We've worked with them to strategize, keeping social distancing, all the things that they can do to keep that population separate and not having an outbreak. Because if we have an outbreak, that would be horrendous on, especially those individuals have a lot of comorbidities, and that would put us in a surge capacity if our hospitals are overrun with that population. So it's really important. That's part of our funding and containment is to make sure our homeless population does not become an outbreak where it's unmanageable, where they're taking up all the hospital beds and causing us to have that surge. Because when your hospitals surge like that, that reduces your other essential medical care. Because if they have all their floors filled with people with COVID because of the enormous resource that it must take to isolate people, then they're not bringing in other people. Other things are being, pushed back in terms of healthcare service. So it's important that we work with them. The pads in Elgin are doing well. They're still housing, isolating themselves as well as Lazarus. So we still continue to work with them weekly to make sure we have mitigation in place to sort of self-contain that population and work with the staff at Hesed to make sure people are, every day they get their symptom checks, and then we do a regular testing to make sure people aren't positive. So there's a regular testing that goes on in any congregate setting.
I'm more concerned with the homeless that are on the street that either can't get in there or won't go to pads. In Elgin, they've taken over the downtown parking garage. People that work downtown won't go in and park their car.
Right.
Because these people are there and maybe they're panhandling, maybe they're making comments, and they've taken over the Carlton Rogers Park, which is just across the street with like a tent city.
Right.
So, I don't know what can be done. I'm just
Right.
saying it's a terrible
And part of the
problem.
problem, yeah, and I know the city of Elgin is struggling with that, but part of the problem is it's called containment. They want, when you're a transient population, that's what you do. You're everywhere, right? You have the freedom to walk around. Well, with COVID, you have to be self-contained within the confines of that pad. It's called a bubble. Keep you in your bubble. You stay with this group of people. And they're choosing not to do that. And we don't have any laws on the books that say we can force you to stay here. And they're choosing, when this started, people were really happy to stay contained. And then when the weather broke, people chose like, no, I'll take my chances. So it is a challenge for us to manage that and help the cities, but the cities have to take some ownership because that's their population to determine, how they're going to mitigate, especially as you indicated, if they're in parking lots. And I know they're in tent cities, they're trying to reduce that. And one of the things that when we were working on all of this, working with Scott Berger on, there's housing to transition people into permanent housing. And so that would be our best benefit, is to get people in permanent housing, so then they would have a place to go. You have fewer people congregating as well, and you're in a permanent place, and you're not taking up these places on the street and in parking lots and even in the homeless shelter.
Actually, there's several empty buildings in what Elgin Mental Health Care Center. And that would be the state. They'd have to make those available. There are, we know that they're empty. It's a huge facility. And I just feel sorry for the police trying to work with it, because those people most of them have mental problems, and they're not going to cooperate, and they don't care, and and hopefully they're not totally lost, but they are.
Well, again, that's a resource that we need to address, and I will follow up with that, looking to see. I remember when we went to the state to use Elgin Mental Health Center for alternate housing, that was a no. But considering we have, things have shifted, so there's no reason I shouldn't go back and ask now what, to keep people off the in tents and parking lots and things like that. So I will follow up with that to see if that could be an open dialogue with the state of Illinois.
One of my research assistants reminds us that they spent $18 million revamping the old Sherman Hospital. It's
Yes.
currently empty.
Yes, it is.
So somebody has to bring all these people together and use these facilities. I've driven by it,
Mhm.
and it's the parking lot, not the parking lot, but in front of the building is full of cars. Why, I don't know. But that would be,
That would probably not be an ideal location because that Sherman Hospital was designed to have the surge capacity if people became ill and the hospitals become overrun with COVID patients. This is where they would go. So it's really clinically based, the way it's designed. It has all your clinical equipment and things like that. And so that,
all I know is it's there, and so is the mental health facility, and they're empty, and there's no coordination. The state has some responsibility here too, to help the cities. Maybe our health director could twist the right arms.
I won't twist a lot, but I sure will have the conversation.
Well, you talk to Christina Castro, she'd be very cooperative.
Okay.
She lives in Elgin, she's a state senator.
Seems a good opportunity for somebody to buy some land and put some tiny homes on there and
Mhm.
population to live. That would be nice. All right, does anybody else have any comments or questions under old business? If not, we'll move on. Can I get a motion, a second to place the reports on file?
Alan moves.
Kenyon, oh, Commissioner Allen moves, Mr. Kenyon seconds. No discussion. All those in favor? Oh, wait, clerk,
call
please
for
call
the-
the roll.
Yep.
Because I'm looking at it.
Allen,
Alan, I.
Kenyon,
Yes.
Sanchez,
Yes.
Silva,
Silva, yes.
Thomas,
Yes.
Weber,
Yes.
Motion passes. No need for executive session, correct? Okay. I don't think we ever do, really. New business? Do we have any new business? Anybody? No? Okay. No public comments on non-agenda items. Could I get a motion and a second to adjourn, please? Mr. Weber moves. Mr. Kenyon seconds. All those in favor, say aye.
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 All right, we are adjourned. Thank you, everyone, for attending.
Thank you.
See us on YouTube.
I went by there